This presentation is on drugs for the skin, eyes, and ears. We'll start with drugs for the skin. Skin conditions or skin disorders are often resolved without drugs. So they just take time and they go away on their own, or our immune system takes care of them. When we do use drugs for the skin, usually they act locally. So usually we can apply them topically to one specific area, and that's where they act. Some drugs do act systemically. They're either absorbed through the skin or we take them orally. Drugs for the skin can be used to treat both the underlying cause, if we know what that is, but they can also be used to treat symptoms, so things like itching, for example. So in general, drugs for the skin are used to treat inflammation and irritation and itching, changes in the skin structure and texture, so for example, things like psoriasis or eczema, and a huge section of them are used to treat infections. Many drugs for the skin are available over the counter. Prescription versions are usually a stronger strength and may be more effective in treating skin disorders. The other issue with over-the-counter drugs is oftentimes people self-diagnose their skin disorder and they go and they choose an over-the-counter product that may actually make the condition worse. Most drugs for this skin are poorly absorbed through the skin, but some can be absorbed systemically, and those you have to be aware of, and you need to be careful with the amount of drug that is applied because it is going to enter the system and affect other tissues. We'll start with antipruritic and anti-inflammatory drugs. So these are drugs that relieve itching, and the fancy way of saying itching is pruritus, and inflammation. Both itching and inflammation are caused by the release of histamine. And we talked about this when we looked at the immune system. So the itch sensation is caused by the stimulation of specialized receptors in the skin that respond to this release of histamine. And the stimulation of some pain receptors will also cause that itching sensation. So itching isn't a disorder in itself, but it's a symptom of many disorders. So for example, infection can cause itching, certain types of disease like psoriasis or eczema, allergic reactions, dry skin, all of these things can create that itching sensation. Interestingly enough, scratching does provide temporary relief as you stimulate other receptors in the area, but it can often make the condition worse and make the itching worse. Drugs that relieve itching and inflammation often work because the underlying cause of the itching and the inflammation is the release of histamine. So drugs can work by reducing the amount of histamine release, and that's what a group of drugs called corticosteroids, for example, hydrocortisone, do. So topical corticosteroids can cause changes in the skin. Sometimes these changes are reversible, so when you stop using that topical corticosteroid, they go away. And then sometimes, though, the skin changes are permanent. And these include things like thinning of the skin and creating stretch marks. So fine blood vessels start to become visible, and this can especially occur in the face, in the facial regions. They can also cause a reduction in pigment, so cause sort of blanched or whiter looking areas. Stopping using them very suddenly can sometimes cause reddening of the skin, and some corticosteroids, especially if they end up acting systemically, can suppress the immune system. So those are some of the risks with using them for a long period of time. If you're just using it for a short period of time for an acute cause, such as an infection or an allergic reaction, then those risks aren't nearly so great. So we can reduce histamine release We can also block histamine receptors, and we're going to talk more about this when we do drugs for the respiratory system. But antihistamines are a group of drugs that sit on top of those histamine receptors so that histamine can't act. So a good example of that type of drug would be diphenhydramine. You can get antihistamines that you can apply locally in a cream or an ointment, but you can also take them orally. There are also some drugs that just act by blocking nerve impulses, and say they numb the area and get rid of all sensation from that area. So things, we call this group of drugs anesthetics, and so the ones that you would use for skin would be local anesthetics. You'd rub it on that area of the skin and it would numb that area. And so things like benzocaine. The last group that can help with itching and inflammation are drugs that cool and or lubricate the skin surface. So these are creams that soothe the area, or emollients. So these are things like calamine lotion. Just a note that as well as reducing the itching and the inflammation, you should also treat the underlying cause if you know what that underlying cause is. A huge group of drugs for the skin treat infections, and so we call these anti-infective drugs, and these can be applied topically. If the infection is very severe, then a person can take an oral anti-infective drug for that, but usually for the skin, infections are local, and topical application of an ointment containing an anti-infective drug is good, will treat that particular infection. So for example, these types of drugs could include antiseptics, antibiotics, antiviral, antifungals, and anthelmintics, which are drugs that get rid of parasites, things like scabies and lice. Many products, especially the ones that you buy over the counter, often contain a combination of drugs. So they may contain an antibiotic to deal with a bacterial infection, as well as a corticosteroid to deal with inflammation. A star. If the infection is very widespread, if it's very severe, so causing severe symptoms, or it penetrates deeply below the skin, so into the dermis area of the skin, then topical drugs may not be able to reach that infection and treat it. And so that's when drugs may be given by a different route, such as oral, so that they can have a systemic effect. They travel through those blood vessels and they get to those deeper tissues, or they get to a wider area of tissues if that's the case. So oral antibiotics or oral antifungals, etc., or even in a very severe situation in the hospital, they may be given by intravenous. One group of drugs for the skin that doesn't fall into an anti-infective or an anti-inflammatory drug or an antipruritic drug are a group of drugs called keratolytic drugs. And these are drugs that are used to encourage the peeling of dead skin. So they remove the outer layer of epidermis, those 20 to 30 layers of dead skin cells, and they promote peeling. So in certain situations we want this to occur. So for example, in treatment of warts, we often want those dead layers of cells that contain the virus that's causing the warts to be peeled off. Sometimes in treatments of acne, it peels away the dead skin layers and it clears away the substance that is blocking the hair follicles, which is the underlying cause of those pimples. Sometimes with psoriasis, for example, we've got excess cell division, so we've got a whole layer of extra dead cells, and again, we want to peel that away. So some good examples are salicylic acid, which is the active ingredient in Clearasil, which is an acne type of over-the-counter medication, or Duofilm, which is and salicylic acid's the active ingredient in that, and that's a wart remover. This series of pictures shows a plantar's wart and the application of salicylic acid over time. And you can see starting here, there's the plantar's wart as it begins, and as we apply daily, apply this salicylic acid, and usually you have to then also file away the dead skin. Then gradually the wart disappears. So speaking specifically of acne, not only do we have that keratolytic drug like salicylic acid, we explained how that works, but you can also use an antibiotic. So if you remember from our physiology presentation this week, acne is caused by blocked hair follicles, and then bacteria invade and causes a little infection in that area. So something like benzoyl peroxide is one of the best over-the-counter medications that you can get to treat acne. So it is both a keratolytic, so it promotes the peeling of some of that dead skin and helps clear the hair follicles, but it also reduces the bacterial growth. There are some options when somebody has inflammatory acne, so quite severe acne, not just sort of pimples and whiteheads. And these can be treated with certain types of antibiotics to get rid of those bacterial infections, or vitamin A type drugs like isoretinoin, which reduces sebum production, which is the stuff that's produced by the oil glands, and that's what ends up blocking the hair follicles. It also reduces inflammation and then therefore helps unblock those hair follicles. Estrogen in some cases, not all cases, may be helpful also. Most topical skin preparations are added to a particular base, and there's a variety of choices that manufacturers can make with regard to what do they put their drug in. So for example, they could put their drug into a cream. Often when they put it into a cream, it has an emollient effect. It's oil and water emulsion, so it's mixed together, and so it's often used for dry skin disorders. So for example, psoriasis. So many drugs that treat psoriasis will be put into a cream. A barrier preparation could be either a cream or an ointment, but it's something that protects the skin against irritating substances. So, for example, it would be put into, a cream or an ointment to protect a baby from diaper rash. So the drug is in that cream, it helps clear up the fungal infection, and then it prevents more moisture from getting into, to make that infection worse. A lotion is a very thin semi-liquid, and so it's often soothing and cooling, especially for inflamed skin, and it's also, because it spreads really easily, used for large areas. An ointment is quite greasy, and so sometimes it's used when it has to be applied in very small amounts, when we want to prevent water from invading, or for some types of eczema. Gel is a water-based, so it's easy to apply, it's non-greasy, and it's more rapidly absorbed than ointment. So when that's required, then that base might be used. A paste is an ointment with a large amount of finely powdered solids in it. So for example, starch or zinc oxide. And often those medications are used to protect the skin and absorb unwanted moisture in that area. A collodion is when it's applied to damaged skin and then it dries and it forms a protective film, and so that's often used when they want to keep the dissolved drug in contact with the skin for a long period of time. Okay, drugs for eyes and ears. Drugs for the eyes are called ophthalmic drugs, and they're used to treat disorders of the eye, including infections, inflammation, symptoms of allergic reactions, and glaucoma. All topical drugs, so drugs that we're going to put right into the eye, are specifically formulated to be the same as tears, physiologically the same as tears. And so putting them in our eye is not going to damage the eye tissues. So you can't just put any type of topical drug in your eye. If it's designed to go on the skin, for example, it can't go in the eye. So you need to look right on the packaging, and it should say ophthalmic, and that means that it is safe to be put in the eyes. Just a note, most ophthalmic drugs work locally, and so they're just going to work in that area. Some may enter the bloodstream and sometimes can have a systemic effect, and so you need to be aware of that. But most of them, when we put them in the eye, they just act right in that area. One group of drugs are artificial tear preparations, and these are drugs that treat dry eyes. There are sometimes it's because it's temporary, or it's because somebody's wearing contact lenses. Sometimes, however, there are syndromes where the eye is not producing enough tears. And if you remember, tears are produced by this lacrimal gland, which is located in the upper outside edge of the eye. And these tears flow and on a constantly being produced and flow across the eye into the tear duct and into the tear sac and into the nasal cavity. And dry eye syndrome is caused when not enough tears are produced, or if the eyelid doesn't close properly and so the tears are evaporated very quickly. Sometimes, as I said, temporarily with people that wear contact lenses, or if they're exposed to wind or sun or certain irritants, then the eyes will dry out. There are many different brands and forms that are available. Different people will respond better to, or can be sensitive to, different brands. They come in drops, which are very, very liquid, gels, which are a little thicker, and then ointments, which are quite thick. So they have a much greater viscosity. Which you choose is really based on how thick you want that drop to be. So an advantage of drops is that they spread really easily, they're not goopy, but they have to be applied more often. Ointments, on the other hand, have a much, much greater viscosity. They're sticky to put in, not as easy to apply, and they create a little bit of goopiness in the eye and maybe blurry vision. But for very severe dry eyes, they keep the eyes moist for a much longer period of time. The next group of drugs we're going to talk about affects pupil size. Now, the size of our pupils, if you remember back to when we talked about the autonomic nervous system, the size of our pupil is controlled by two sets of muscles, which are controlled by our autonomic nervous system. So there are circular muscles, which are the inner set of muscles, and then the outer set of muscles in the iris are the radial muscles. Our parasympathetic nervous system stimulates our circular muscles to contract, and so then our pupils constrict. Our sympathetic nervous system, when we're frightened or excited, causes our radial muscles to contract. Those are the ones on the outside, and that then causes our pupils to dilate. So the sympathetic system controls one set, the radial muscles, and the parasympathetic system controls the other set, the circular muscles. So we have some drugs that will affect pupil size, and they work by mimicking either the parasympathetic nervous system or the sympathetic nervous system. So mydriatic drugs will dilate the pupil, if you take a look here. So they cause the radial muscles to contract. So they act like the sympathetic nervous system. Because they mimic the sympathetic nervous system, we call those types of drugs sympathomimetic, mimicking the sympathetic nervous system. When we might want our pupils to dilate is when we're at the optometrist or ophthalmologist and they want to get a better view of your retina. So they want more light to go inside the eye so that they can see better what's happening in there. Sometimes they can cause temporary paralysis of the ciliary muscles, which is the muscles attached to our lens. And so this can help with determining focusing areas in young children that can't, read the eye charts. So some good examples of mydriatic drugs are atropine or phenylephrine. So these are drugs that act just like our sympathetic nervous system. Miotic drugs are drugs that are dropped into the eye that cause the pupil to constrict. So there are two groups. Some of them mimic the parasympathetic nervous system, and so we call those parasympathomimetic, sometimes called cholinergic drugs because they act just like the neurotransmitter that works in the parasympathetic nervous system, which is acetylcholine. There's another group of drugs that block the sympathetic nervous system, and so they block the effect on the radial muscles, and that will also cause the pupils to constrict. Most of these drugs that constrict the pupil are used for treatment of glaucoma, and we're going to talk about that in a second. So glaucoma is a disorder of the eye in which the fluid inside the eye starts to build up. So there's an increase of pressure inside the eye, and that ultimately, as this pressure increases, it can push back and damage the optic nerve. There are two main groups of glaucoma. Glaucoma that occurs slowly over time, we call that chronic glaucoma, or there's another type that happens very, very suddenly, acute glaucoma, and that needs immediate medical attention. So pressure builds very rapidly, creates blurry vision, a red and painful eye, headache, vomiting, maybe see halos around the lights. And that is a medical emergency, and it may cause blindness if it's not treated right away. So fluid in the eye is produced down here by little cells, and it flows up and over the lens, and it drains down here. This is the iris. And so if we can cause the iris to contract, then that can open up this little angle and allow fluid to drain. So many drugs for glaucoma release pressure by increasing drainage. Some of them work directly on these little cells to reduce fluid production also. A very common eye disorder is called conjunctivitis. Now, your conjunctiva are the membranes that line the eyelids and line the surface of the eye, the outer surface of the eye. And when these become inflamed, remember itis is inflammation, then that causes conjunctivitis. The layman's term for conjunctivitis is pink eye. Now, conjunctivitis can be caused by a number of things. Viruses, usually it's a bacterial infection. That's the most common, and a bacterial infection is very contagious. And so if somebody touches their eye and then touches their other eye, for example, that will spread that bacterial infection from one eye to the other. Also, if they touch their eye and touch somebody else, their hands, who touches their eye, then it can spread to other people. So especially with kids, if children have pink eye, they're usually recommended to stay home from school because it is very, very contagious. There are some other things that can cause that redness, that inflammation. So allergies can as well, certain irritants like dust, for example, or trauma. Now these are non-infectious. So treatment of conjunctivitis involves treating the underlying cause, which most commonly involves treating a bacterial infection. So we'll talk about anti-infective drugs that you can put in the eyes. Usually, again, anti-infective drugs that we put in the eyes have a local effect, and they treat superficial, so just at the surface, bacterial infections. Those would be antibiotics. Viral infections, those would be antivirals. fungal infections, anti-fungal medications. You can buy ophthalmic anti-infective drugs over the counter, and you can get a stronger version by prescription. I always recommend that you get a proper diagnosis, and rather than just going and purchasing a polysporin, for example, that contains an antibiotic and hoping for the best, it's probably worth your time to go and get a proper diagnosis as to what the infection is, and get a prescription medication which is going to be a lot more effective in treating that infection. Again, you can get these anti-infective drugs as drops, as gels, or as ointment. If the infection, again, is very widespread, so meaning that it's affecting large portions of the eyes, if it's creating severe symptoms, or it's penetrated tissue deeper than just the surface, then systemic drugs may be given so that they can reach those underlying tissues. Some other ophthalmic drugs, anti-inflammatory drugs, can reduce inflammation in the eyes. Antihistamine drugs can be dropped in to reduce eye irritation that's due to the release of histamine, so allergies. And local anesthetic drugs can be dropped in that will block nerve impulses, and that is used to treat eye pain, or anesthetic drugs that treat eye pain. Okay, so I'm going to go over the procedures for administering eye drops, and then next week I'll give you a demonstration and you'll have a chance to practice this. You will need to know how to do this for your practical assessment, which is at the end of the course. So we start with gathering all of our materials, our MAR sheets, drugs, anything else that we're going to need in order to do this procedure. And we want to check our 7 rights, and we'll check them twice. Wash your hands thoroughly and or wear gloves. Then you want to shake that solution, the eye drop container, remove the cap, making sure you don't touch the top of the dropper to anything, not your hands or the surface of the counter or that person. And set the cap down on the counter, and then you're going to do your second right, or your third check of your 7 rights. In order to place the drops in the eye, a person needs to have their head tilted back. It may be easiest to have them actually lie down or sit in a chair where their head can go backwards. If they're standing, it's very unstable. So have them sit down or lie down. If it's a child, you can actually have them put their head on a pillow in your lap, and that allows you to be nice and stable. Then you're going to pull down their lower eyelid away from the eyeball. In this particular picture, the person is using their thumb. You can also use your fingers to pull this down. Notice that she's got her fingers here stabilized against the forehead also, so that she's keeping the head still without squeezing, and is applying just a gentle pressure to pull this down and away from the eyeball, and it forms this little pocket underneath the eyeball. Now, a very important thing is to have the person pick a point on the ceiling to look at before you drop the drops in. And this is so that if they are looking directly at the drops or at you, then they're more likely to blink when the drops go in, or before the drops actually reach their eye, and then the drops end up going on the outside of the eyelid. So have the person focus on something on the ceiling or up above so that their eyeballs are looking upwards, and then hold the dropper close to the eye, but don't again touch the tip to the eye or to the eyelid or the lashes, so it's just in the air there. And then you're going to squeeze the container and allow the correct number of drops to fall into that little pocket, and then release the lower lid and ask that person to close their eyes gently. This allows the fluid to move all around in the eye area. What you can do is take a tissue and apply gentle pressure to the inner canthus. This is the inner part of the eye, and close to the nose, so right over top of the tear duct. And they can do this themselves. You can give them a tissue, or you can do it for them. Don't rub the eye or let them rub the eye, or don't let the solution run from one eye to the other. And you're just going to hold that there briefly, and that just prevents the eye drops from running straight from the pocket right into the tear duct and the nasal cavity. And then you'll document correctly on your MAR. So you'll have to put a dot and initial, because you can't dot pouring the medication because it goes right from the container right into the eye. And then wash your hands. So administering an eye ointment or gel is very, very similar. So the first 5 steps are the same. The difference is in the application, and again, you're going to squeeze the tube without touching the tip. So you don't want to touch the tip to the eyeball or the eyelid. So the only thing that should touch is the medication itself. And so you're just going to put a very thin ribbon, usually about 1/4 to 1/2 inch of that ointment or gel, to the inner surface of that lower eyelid, and then the person will gently close their eyelid. And because this takes longer to move around over the surface of the eye, they should keep their eye closed for about 2 minutes and have them rotate that eye around underneath that closed lid to help distribute the medication all around. So after about 2 minutes, then you can give them a tissue to wipe off any excess ointment or gel that's around their eye on the outside with that clean tissue, and then document correctly on your MAR and wash your hands. Drugs for the ears are called Otic drugs, and these are used to treat disorders of the external ear, so of the auditory canal. And these types of drugs are usually anti-inflammatories, or they treat infections, so antibiotics or antifungals, or a combination of both of them. There are also some drugs that can be dropped into the ear to help dissolve earwax, and that includes mineral oil, which is my personal favorite, or there are some more toxic types of solutions or harsher solutions that are available over the counter as well that will help dissolve earwax. So disorders that of the middle ear or the inner ear are going to require drugs that have a systemic effect, because topical Otic drugs are not going to be able to reach those parts of the ear. Okay, so administering ear drops, again, just like administering eye drops, please make sure that you're comfortable with this. Review it now, and we will go over it again with a demonstration next week, and you'll have a chance to practice this. And again, this is a technique that you may have to use when you are doing your practical assessment. So again, you're going to gather all of your materials. You'll check your 7 rights. You'll do that twice. Wash your hands thoroughly, or wear gloves. And then you want to wash and dry the outside of the ear carefully. And you don't want to get water into the ear canal. A good technique is to use a baby wipe or an alcohol swab. And again, all you're doing is just cleaning the outer section of the ear. So just out here and where you reach, you're not going to stick anything into the auditory canal itself. It's helpful if you warm the drops up. It's not quite so shocking when they go into the ear, but don't warm them up. You would never use a microwave or hot water or anything, because you could burn the inside of the ear. So simply just warm them up in your hands by holding them in your hands for a few minutes. And then you're going to shake the container, remove the cap, and again, just like with eye drops, don't touch the tip of the dropper to anything. It should just be air, and that's it, and the cap. And then you'll check your 7 rights a 3rd time. You want the head to be tilted to the side. The easiest thing is, especially with children, is to have them lie down, or in some place that's comfortable. Sometimes it's difficult to hold your head in a position. And remember, once you put the drops in, the drops should stay there for about 5 minutes. So they need to be in a position that they can keep for about 5 minutes. A real secret to effective administration is opening the auditory canal so that the medication can get nice and deep into the auditory canal. The auditory canal in adults has a little bend to it. So you can see where this dotted line is on this picture. And so if you take the pinna and pull it backwards and upwards, that will straighten out this auditory canal. And then when you put the drops in, they will go deeper into that canal. With children that are under the age of 3, their auditory canal has a slightly different bend to it. And so if you pull the ear backward and downward for young children, then that will straighten out the auditory canal. And again, the medication will get in a little bit deeper. So once you've opened up the auditory canal, then you're going to allow the correct number of drops to drop into the ear canal. Again, not touching anything with the tip. And then once the drops are in, then either you or have the person do it themselves. Just push on this little flap of skin right over here. Just push on it to get rid of any bubbles that are there, and it just helps wiggle that medication down a little further into the canal. You don't have to hold it there, but just push on it a few times and wiggle it a little bit and allow that stuff to get as deep as possible. And then the person should just relax and keep their head in that same position, lying down or tilted to the side for about 5 minutes, and that allows the medication to work in that area. They can sit up and give them a tissue to allow that excess fluid to drain onto it, and you can gently wipe any other excess that has flowed outside the ear, wipe that off, and then document correctly on your MAR and wash your hands. Okay, this is the end of this presentation. Again, we're going to practice these techniques next week, as well as do another practical activity as well. If you have any questions at all about this material, please don't hesitate to contact me.